Welcome to Healthcare Weekly, the podcast where we interview healthcare workers about their experiences. COVID-19 is a hot topic of discussion in the healthcare world as it has impacted everyone across the world and changed healthcare forever. Even though COVID cases are going down, the effects of the pandemic on healthcare workers is long-lasting. The CDC reports that over 4.5 million people have been hospitalized due to COVID-19. Likewise, according to the New York Times, healthcare workers have endured psychological trauma, guilt, fatigue, and brain fog due to the pandemic. I sat down with Katie Brooks, a registered nurse at a small-town community hospital that describes the burnout and altered healthcare culture post-pandemic. Here's Katie now.
My name is Katie. I have worked in the ICU at a community hospital for almost 5 years. I have always worked in the ICU, and recently I have started doing some nursing supervision as well. I originally got into nursing just with a desire to help people. My grandmother was a nurse, and she always absolutely loved it. And so I think she was a big inspiration in my pursuit of nursing. Whenever I first started nursing, I think that I definitely had very, very much a great desire to help people. I think that pretty much feeds anybody's desire to be a nurse. As you can imagine, there has been a big change in the outcomes of our patients. I think that is what has made me feel the most burnout as a nurse, being in the ICU primarily. We don't see our patients get better like we used to. We don't see them move out. It seems like everybody was dying. Whenever you have an older patient population, 70s, 80s, 90s, it's a little easier to swallow the death process. But whenever it's 20s, 30s, 40s, 50s, that's a whole different thing. And I think that is really led to a lot of burnout in me and in my coworkers, is that we worked so hard on these people and keeping them alive for days, weeks. We get attached to the families, and then they still all have the same outcome. We just have so few success stories, and it's not any fault of ours. It's not like we're providing poor patient care. It's just that, this virus is just so terrible that it's just killing that many people. Myself, I've definitely thought about leaving healthcare, but I have coped with the burnout more by just working less. So I work PRN, and I think because I'm there less hours than a full-time staff member, it kind of helps me to be able to cope with the burnout a little better. But I've also started doing photography on the side too, because that was always a hobby of mine, and it's just kind of helped me to be able to have a different avenue besides just nursing. But a big reason that so many nurses and healthcare workers are leaving healthcare is just because of the burnout. I mean, you have all these COVID patients all the time, and you don't see them get better, or you're working understaffed in dangerous working conditions, whatever. And that gets very exhausting, mentally exhausting. Having to deal with that every single shift you work and keep these people alive it's very taxing mentally. And I think that's why we're seeing such a big exodus, that healthcare workers and nurses in particular will have some form of like PTSD when whatever all this settles down. And it's sad whenever that's the status quo. I feel like we have warped sets of coping, but how can you mourn every loss and you would carry so much weight? The burden would be so high that you almost have to distance yourself to be able to move on, So yeah, there's not a lot of positive, unfortunately, right now.
After hearing about Katie's experience, I definitely want to thank every healthcare worker in my life. If you don't work in healthcare, it's easy to take those heroes for granted. Let's all remember that healthcare workers are tired and give them a much needed break. Until next time, this was Healthcare Weekly.